My name is Ramesh Nalia, and I'm a general dentist and I'm faculty at Harvard School of Dental Medicine. Dentistry interacts with various levels of the healthcare system, and I want to talk to you briefly about some of those interactions. Dentistry interacts with pharmacy in many ways. Firstly, xerostomach drugs have a massive impact on oral health. Saliva is an important defense against dental caries, and so in the absence of saliva, caries can spread rapidly. So when patients begin a drug that has xerostomach side effects, the provider or the pharmacist should have a conversation with the patient about visiting the dentist for a checkup and maintenance. Next, reflux has a major impact on oral health as well. Some medications cause reflux, some medications are taken for reflux. Whenever these medications are given to patients, there should be a discussion with the patient about their oral health, because acid has an effect on the teeth in two ways. First, it causes erosion and breakdown of tooth, and second, because caries is an acidic process, in the presence of more acid, caries can spread more rapidly. And finally, there are some mood-altering drugs that actually cause the patient to grind their teeth more and more severely. So whenever a patient is prescribed a mood-altering drug, there should be a conversation again to speak with a dentist. Dentistry and medicine interact in many ways because oral health is connected to systemic health. There are many general health conditions that influence oral health, and there are many oral health conditions that can have systemic effects. And so medical doctors need to know a little bit about oral health and need to be strong advocates for oral health in their patients. There's a growing volume of knowledge that actually having good preventive dental care can reduce overall healthcare costs. Pediatricians specifically should know a lot about oral health actually, because of a phenomenon called vertical transmission of dental disease. And this is the process whereby a mother can pass on caries bacteria to their child, because caries is an infectious disease and a lot of people don't realize that. So pediatricians need to know about that. Also, pediatricians are licensed to be able to apply fluoride for their patients, and they can actually be reimbursed for this. And so pediatricians need to be checking their patient's mouth and even applying preventive fluoride. Emergency room docs need to know a lot about oral health. Every year in the United States, about 1.35 million emergency room visits are primarily because of dental problems, and this is close to a $1 billion problem. And actually a lot of these patients, about 51,000, end up being hospitalized, and this is a huge burden on the healthcare system. So ER docs need to, on top of all the other things they need to know a little bit about oral health and how to make diagnoses and how to manage those urgent conditions. In fact, there's some research that shows that only about 67% of dental visits to the emergency rooms are managed appropriately. So this is an area that needs expansion and improvement. Well, cardiologists need to know a lot about oral health as well. This is because there's some literature to show that the periodontal disease is actually related to cardiovascular disease. Family medicine docs and internal medicine docs need to know a lot about oral health too. They are an important figure in the lives of individuals and families, and they have the opportunity to serve as strong advocates for oral health. Having improved oral health can reduce overall healthcare costs, and there's a lot of research that's adding to this body of knowledge. And so family physicians and internal medicine docs need to partner with dental providers to advocate for good oral health. Sleep medicine doctors need to know about oral health too. Obstructive sleep apnea has been shown to have a connection to periodontal disease, and so patients with OSA should be referred to their dentist also. Nurses have an important role in oral health too, in hospitals, in aged care facilities, in special needs facilities. A common problem is lost dental prosthesis, lost dentures, and so nurses have an important role in taking care and organizing those situations. Also, there is a lot of unmet need in institutionalized individuals, and nurses have a role there in connecting patients with healthcare providers. And as I've mentioned, there's a large burden of patients in hospitals, about 51,000 each year, who become hospitalized primarily because of a dental problem. And more than that, there's a lot of patients having medical procedures and surgical procedures who have concurrent oral health problems. And research is beginning to show that actually having a dental problem when you have another surgical procedure increases healthcare costs, worsens outcomes, and can actually lead to complications in your surgery. Physical therapists have an interaction with oral health too. It's important for dentists to know a little bit about whether their patient can lie back, how far can they lie back, how long can they lie back, and then if patients have temporomandibular joint problems and pain, sometimes the dentist will actually partner with a physical therapist to provide care. Therapists, psychiatrists, counselors, mental health professionals, they have a lot to do with oral health too. Problems like depression can be very debilitating, and patients sometimes actually are not able to take care of their teeth. And also, some of the medications that are used, mood-altering drugs, can be very xerostomic, which can actually worsen oral health rapidly and dramatically, and also can lead to patients grinding their teeth as well. More than this, research in hospitals shows that when patients have a mental health condition and a dental problem, their healthcare costs are much higher than if they only had that dental problem. Social workers are an important point in the healthcare system, and their role in dentistry is important too. They can serve as strong advocates for their patients, and they can also be experts in navigating through the complex oral healthcare system and helping patients find a provider who is suitable based on their insurance. So social workers have a critical role actually. So as you can see, oral health interacts with every branch of healthcare, and dentists need to know a lot about their patient to be able to deliver appropriate patient-centered care. And all of the health professions need to collaborate closely to be able to provide the best care and achieve good healthcare outcomes for their patient.